new WS-led Improvement Science Collaborating Centre is unique. One of the reasons it's unique is bringing together academics, but more importantly, the academics that are involved in clinical practice. There are three key aspects with regards to this video. The first aspect is how the service user and the carer is key to what we do. For every piece of research, we will ask, how will it affect the patient or the family?
I'm Sandy Galbraith from Owen, and I've done research on the same as you. There were 5 of us and as a team. We were 2 with disabilities, and we started off looking at what questions we could ask. We made recommendations how they could improve people's life with a learning disability or a physical one.
Aspect number 2 is our unique focus of research, which is both outcome, person-centred and culturally focused.
It's one of the unique things I think about the staff working in our Institute of Care and Practice Improvement is that we're all heavily involved in practice. So we all work in practice at least one day a week. So we're very familiar with the challenges and innovations that staff are taking forward in their day-to-day practice, and that really helps to inform the research work that we do. What we have in our partnership for the proposed centre is a unique blend of expertise in terms of research. We have traditional approaches to research, we have improvement science, we have action research, appreciative inquiry, and it's about bringing together a very eclectic fusion of these different approaches that I think is really quite unique. So currently I'm working with 140 care home managers across Scotland. And we're using appreciative inquiry, so we're looking at what works well for them in their current practice and how can we understand that better and use the processes that work well. Care home managers talk about how different it is because they're so used to people identifying problems and perhaps blaming them for things that are not going well, that to have this different approach to really examine things going well is very refreshing, quite motivating, and touches their hearts and minds.
The training we've been doing is all practice learning. It's practice based and it's so different from everything else I've done before. It's about experiential learning, as in it's everything that we experience in a day-to-day that we pass on, and it reinforces good practice, and it has allowed me to change my methods and how I deal with people on a day-to-day basis, both staff, residents and everything, and it's actually made a massive difference in the care home. It's changed the whole ethos and culture of how we care.
The SISCC that Professor Rooney and colleagues at the University of Western Scotland are proposing sounds really interesting and innovative to me in a number of ways. One of the things that I like the most is the way in which it seeks to bring lots of different parties together who are all involved, all have a stake in the improvement of quality of care. So academics, caregivers, managers, patients, finding really innovative ways to try to create new ways of communicating between those groups.
I love some of the innovative ideas they put forward around bringing clinicians and researchers together. You know, working groups. I love the idea of a writing group, the editor in residence. We have found at the Institute removing barriers for clinicians to publish is really important, and that was a really terrific idea.
Definitely allow the best of the best to participate and bring together not only the minds for research, but also a proving ground where they can test some of these ideas. The approach of patient-centeredness is going to be key to making sure that what the work that we do is going to be in favor of what patients and families need and want in their care. And also the fact that there's a capability building aspect of the work which will continue to develop others to learn more about how to change behaviors and how to implement improvement.
We're also very interested in any research and development that can be done around the role of assurance or scrutiny in quality improvement. And of course our robust evidence base is something that we have been founded upon as an organisation, and we see great benefit in working with the University of Western Scotland and the Collaborating Centre in establishing a new evidence base around quality improvement.
They also spent some time talking about the importance of both improvement skills, knowledge, but also the development of culture. It's those wonderful seeds of skill and knowledge, if they fall onto fallow ground, there's no uptake, there's no ability of the service to use it, no culture of improvement, they fall fallow. So I thought that was a very wise investment of their time in thinking that through.
Lastly, the network opportunity that the Centre proposes to put together is part of our continual learning process, because no organization learns just at one time. We're always learning continually from each other. And in the IHI model of all teach, all learn, this will give that opportunity for all to teach and learn.
Improvement science is a young science, but it is science, and it needs to be thought of that way. And I think the way that the University of West of Scotland and the SISCC bid is being positioned is to think about how do we blend improvement science and that the rigor from a scientific approach with the way clinicians work. At the end of the day, all we all really care about is results. All we really care about is improved outcomes for patients and families and users, carers, and the social system, indeed all citizens of Scotland.
And last but not least, the third aspect is about getting evidence into practice and knowledge into action.
Hello, I'm Rosemary Lyness. I'm the Director for Nurses, Midwives and Allied Health Professionals in Lanarkshire, and I'm very excited and enthusiastic about the opportunities that this improvement science research brings for us. I think more now than ever within the health service, and I've worked in health now for over 37 years, there's a very clear mandate that improving quality and reducing variation is absolutely supported both locally and nationally. So within Lanarkshire, I think we can bring a lot to this collaborative enthusiasm, which I hope is very clear. Also a lot of knowledge. We have in recent years hosted the National Lean Network for Scotland. We've also participated in collaboratives around scheduled care, unscheduled care, releasing time to care, and I think the opportunity is there now in conjunction with colleagues from the university and the wider network to actually turn that into something that's more meaningful, sustainable, that hopefully will benefit patients and service users in the future.